Here's what happened this week at City Council.
The daily positive cases have dropped by about 60% since November 7th, and our COVID hospitalizations have declined 20% during the past 3 weeks. So that said, we continue to work at the state and federal level to ensure that we assist our hospital readiness. We currently have 1,462 medical staff here assisting our local hospitals. We also have some good news in preparation for the release of a vaccine. We have 161 local providers that are enrolled and approved by the state to dispense COVID-19 vaccines, and we expect an initial allocation of the vaccines here in El Paso sometime this month. On the testing side, we're averaging approximately 5,800 COVID-19 tests daily, but we have the capacity to do over 10,000 tests a day, so there's plenty of capacity, and we encourage the community to continue to come out and get tested if you think you may have been exposed to the virus. Our Pledge to Safety program continues to grow. We now have 739 businesses that have taken the pledge to keep El Pasoans safe. And so all of this is important in that it takes all of us to do our part in slowing the spread of the virus. We're encouraged by the declining number of cases that we're seeing here in El Paso, but we all need to be even more vigilant as we approach the holidays.
So we presented to City Council how we finished our fiscal year 2020, which ended August 31st of 2020. Very happy to report that we actually ended the fiscal year with a $9.3 million surplus. Again, very positive news. Not only that, but we were also able to increase our budget stabilization fund. So increasing that budget stabilization fund up to almost $17 million. So very, very good news. Our revenue sources performed extremely well even during the health pandemic, the COVID-19 impact that we saw. Our revenues did perform pretty well. We were able to implement proactive budget adjustments on the expenditure side in order to make sure that we did end the fiscal year with the surplus. Currently, we are receiving federal funds in order to respond to COVID-19. Unfortunately, that ends on December 30th. However, we've been very proactive over the last several years. This past March, prior to the COVID outbreak here in El Paso, the City Council approved the creation of a budget stabilization fund. And as I mentioned, we have almost $17 million in this fund now. And so on Monday, what we asked the City Council to approve and what they did approve was allowing us to continue to use the budget stabilization fund to be able to respond to the COVID-19. So without that federal funding, we do have local funds now in place, again, being very proactive to continue doing all of the things we've been doing on the public health and safety side as far as the response to the health pandemic.
There was no council action taken. They were just complying with the reporting requirement of their agreement. So the Medical Center of the Americas is a great benefit to our community because they provide us with a medical campus that serves as a hub for medical services and innovation. They report to us to ensure that they are performing positively and staying in compliance for the duration of their agreement.
We discussed item 11.1, and the gist of that item was to increase the contract with our vendor so that we could provide better services as far as food to the community and to the shelter pets. We've had many increases in initiatives here at the shelter, and it's going to help us provide those resources to the community for the pets that are in need. This item was important for the community because it ensures that we're going to care for the shelter pets better. They're going to have the food that they need, and it also ensures that the animals that are owned by our citizens can have access to the food that they need through our pantry, through our doggy DoorDash, and through our COVID response.